Today, we're going to talk about a very important topic of internal medicine, and we usually come across these patients of myalgic encephalomyelitis. Now, what is this condition of myalgia? That is basically pain in the muscles. Now, in simplest words, we can define it as a layman describes that he or she has severe pain in his or her muscles. So this is the usual clinical picture that the patient is going to have. And apart from this particular scenario in which the patient is having pain in the muscles, he or she may have the other comorbid conditions as well. So we must have this clear picture in our mind that apart from this muscular pain, the patient can suffer from a lot of other clinical features as well. Sometimes it's quite a confusing picture to identify what this particular patient is suffering from. So we have to basically focus on the fact that the clinical picture varies from patient to patient. It's not just a typical clinical scenario, and it's not always very easy to identify these patients of myalgic encephalomyelitis. And this condition is also known as a chronic fatigue syndrome. So two keywords we have over here. First of all, we have myalgias in the patient. And on the other hand, chronic fatigue is one of the sign and symptom that we have to focus on. So this is the usual complaint that the patient is going to have. But is it something real, and how do you really diagnose these cases is again very interesting. Of course, it's a diagnosis of exclusion. So basically, first of all, you rule out all the other causes which can cause this malaise, this fatigue, or this fibromyalgia that the patient is having. So these are the scenarios that you have to focus on, and the diagnostic criteria again can be quite confusing. It's basically a wide variety of clinical picture that we are dealing with. It's quite common. Almost 200,000 Americans are almost suffering from this condition of CFS, that is the chronic fatigue syndrome. It's sometimes quite debilitating for the patient, and sometimes it is a milder picture on one hand. So it can differ from patient to patient. The severity varies from patient to patient, and we even modulate towards the treatment plan differently according to the cases that we're dealing with. For instance, when we went through the case of Gracie, we particularly noticed the fact that what were the causative factors that were engaging this particular patient into this condition. The multiple infections, the respiratory infections, were leading the patient towards this myalgic condition in case of Gracie. So this was the particular history. And another one of the most important factors was obesity that Gracie was suffering from. So these two factors were basically contributing towards the development of this fibromyalgia condition in case of Gracie. But it's not always the case. And we have to go through the particular etiological factors in different cases. So it can be the perpetuating factors, it can be the predisposing factors, and we'll be particularly going through that over here. So again, just to have an overview, myalgic encephalomyelitis is also sometimes known as POTS syndrome. It's basically a syndrome of tachycardia in which tachycardia is the predominant feature. Then sometimes the patient have myalgias, and that is why it is sometimes known as the myalgic encephalomyelitis. Then it is also known as chronic fatigue syndrome, in which the basic symptom would be the fatigue that the patient is suffering from. Now, how do you identify a normal fatigued person from a person who is suffering from chronic fatigue syndrome? Over here, we are not focusing on the fatigue that the patient is having, an isolated fatigue. It's a fatigue syndrome, fatigue that is associated with certain other signs and symptoms as well. For instance, it can be a headache, it can be orthostatic intolerance, it can be the other set of signs and symptoms that the patient is suffering from. For instance, the sleep disturbances, psychological element is something that is the predominant element in cases of the chronic fatigue syndrome. When we go through the list of signs and symptoms in cases of myalgic encephalomyelitis, we come across this fact that basically it is a multi-system disease involving the neurological factors, involving the endocrinal factors, as well as the immunological factors, and as well as energy metabolism is also affected in these particular patients. So these four factors are basically contributing towards the overall health signs and symptoms that we observe in these patients of myalgic encephalomyelitis. You have to focus on all of these factors. Whatever you find out in a particular patient, you have to highlight that factor, and it's not a rule that the patient would be suffering from a typical picture of signs and symptoms. The clinical picture usually varies from person to person, and that is the reason that sometimes it's quite difficult to diagnose these particular cases of myalgic encephalomyelitis. Now, the causative factors can basically range from the causes in the environment. So the environment can even contribute towards the development of this particular condition. Then the person himself, for instance, genetic factors are something that is also contributing or that is also making the patient more prone to the development of this particular chronic fatigue syndrome. And again, if the patient is suffering from the pros and cons of infectious states, for instance, in our case study, Gracie was having infectious mononucleosis. So she had this particular condition and she went through the particular respiratory infections from time to time that basically led to the decrease in the immunity of the patient. So this was the key factor over here. And that basically led to the development of this particular fatigue syndrome that Gracie was having. Another comorbid condition that she was having was the obesity that she was suffering from. So these were the contributing factors. And we have to highlight these contributing factors in our history. And then, of course, you're going to run your diagnostics to rule out what particular condition the patient is suffering from.